So, hi everyone. My name is Bridget Muthoni. I'm the Kenya Program Manager, Girls Health Ed, and this evening I'm excited to welcome you all. For those who it's morning in their country, good morning, good afternoon, and good evening. So, as we start this webinar, I want to welcome you all and thank you for attending. So, I just want to jump right into it. And a few of our panelists are having some challenges, but they'll introduce themselves later. In the meantime, for the panelists who are here, kindly introduce yourself, and we can start with Manuela. Thanks.
Thank you so much, Bridget. Hi, everyone. Thank you for the opportunity to be here. I am Dr. Manuela Balliet Ahogo. I work for Together for Girls, a global partnership working to end sexual violence against children and adolescents, especially sexual violence against girls. I am the African Regional and Policy Advisor. And at Together for Girls, I provide support to African countries in the implementation of the surveys on violence against children, called the VAC surveys. I also coordinate research projects, and I provide technical support to other research activities. So I'm a public health researcher by training. I've just completed my PhD at the London School of Hygiene and Tropical Medicine. My PhD, my doctoral research explored school-related violence or risk factors to violence, especially school-related gender-based violence. I'm from Côte d'Ivoire, and I'm currently based in Abidjan. I'm really happy to be here with you today.
Thank you so much, Manuela. And that's exciting. It's an amazing introduction. I believe that anybody who wants to do research, they can always reach out to you, and you can be of Faraj, kindly introduce yourself. Thanks.
Okay, good evening, good morning again. My name is Faraj Jamil. I'm the media officer for Helping Hand for Relief and Development. I'm also a filmmaker, documentary, and feature films. I do films and documentaries. But currently I'm based with Helping Hand for Relief and Development. I'm glad to be here and to share my sentiments with you.
Okay, thank you so much, Faraj, and thank you for gracing us at this hour. And then the other panelist is Pavita Singh. She's the executive director and my boss from Girls Health Ed. Pavita, the floor is yours.
Thank you so much, Bridget. As Bridget mentioned, I'm the executive director of Girls Health Ed. I'm currently joining this call from New York City. This is a very proud moment for me to see Bridget, whom I've had the pleasure of mentoring and collaborating with for the past, I think, 6 or 7 months now, moderating a panel. And she organized this webinar and this entire campaign around ending gender-based violence pretty much all by herself. So I'm extremely proud of her, and this is a great moment for me. But yeah, I have been in the executive director role at Girls Health Ed for about 4 years now, coming up on 4 years in March. But I've been part of the organization pretty much since the beginning. So it was still in its infancy when I joined, and I started off as a volunteer. Then I worked my way up to director of programs and outreach. And as of 4 years ago, I'm now honored to be in the executive director role. In today's webinar, I'm very excited to bring in my expertise about gender-based violence, largely brought in from my Master's of Public Health training at Yale University. Now, almost 10 years after completing my Master's of Public Health, I'm now in a doctorate program in public health at Columbia University. In addition, I am a freelance writer and editor and the author of 2 books, and very excited to be part of this conversation. And again, huge shout out to Bridget for all of your hard work on this webinar and on this campaign. Very proud of you.
Thank you so much, my boss. And yeah, I'm happy to for all of you for gracing this event. If you want to order her books, you can always go online and hire them at Amazon. She's an amazing author and she's a poet. You can always reach out and listen to her. Yeah, so I'll just jump right in as we wait for the other panelists to join. And I'll start with Faraj. Hi, Faraj. So my first question will be, how can media play a positive role in raising awareness and educating communities about gender-based violence?
Well, okay, thank you. So media generally, I hope everyone is getting me clearly.
Yes.
Okay. So media generally, the functions of media are always to create awareness and educate in such situations. But most of the times we get that what is being put out there is a negative outcome of what really gender-based violence entails, and such issues are put in a negative manner out in the media. So I'm going to just note a few things on how media can play a positive role in creating awareness in a positive way. And I'm also going to base according to how we work, basically in my organization, and how we try and we create awareness for gender-based violence. So one of the things that media can have a positive impact and how to really do it is during news coverage. When these incidents are reported, most of the time they are negative. So one of the things that can be done is to sensitize the journalists and the media houses to report in a manner where there is no victim blaming, and it also covers the persons involved. It should provide the accurate and responsible coverage of gender-based violence incidents to raise awareness to prevalence and serious issues. And that's just one of the ways how news coverage can really assist in bringing out a positive impact on gender-based violence. So it's really just sensitizing the journalists and people who are in the media on how to report issues of gender-based violence. Number two is doing documentaries and films, feature films. So documentaries can really impact the people because these are real life stories of survivors, activists, and organizations such as ours and yours. So producing documentaries and feature films will help combat gender-based violence and create awareness out there on what really gender-based violence is, what to do uh, after an incident, how to go about it, because this will be stories from survivors, will be stories from activists, maybe like us, who really know what's going on. And then it should also showcase the interventions and initiatives that have effectively addressed gender-based violence. So as these documentaries and feature films are produced, they should just not base on the stories of the people who are affected. It should also bring out the interventions that were taken and measures that were taken to prevent and control such incidents. Another point is public service announcements. These are basically short messages which are basically done by the government or NGOs like us. So these public service announcements can be created to spread messages on television, on radios, because we have a very wide scope of how people get information. There are some of us who listen to radios, who watch television, the news. So having these public service announcements in between the daily shows, maybe in between news coverage, will be really important, because it will be giving also the government a chance to utilize the voices of people who have been affected, of people who are against such incidences, the activists. So public service announcements are a very important way of creating awareness positively to the community and to the people out there. The next point, we are living currently in a very large social media world because everything we're getting it online. So social media campaigns can be another way of creating awareness positively, and just engaging these platforms like Facebook, we have Twitter, engaging them positively, that is like creating hashtags on such incidences, just noting certain incidences that really spiked emotions on social media will create campaigns that will help people have knowledge on what gender-based violence is, on what actions to take, and interventions and initiatives to take. So social media campaigns are a really important way of creating awareness positively and educating the masses. Number 6, I believe, or 5, is education programs. I can give you an example of how Helping Hand collaborates this in its programs. Under Helping Hand, we have an orphan support program. So under the orphan support programs, let's say in Nairobi, Kenya, to be specific, maybe let's say Kibra slums, we have a focal person in the Kibra slums who monitors, assesses our 200 sponsored orphans in the area. So the person there, the focal person, is responsible of conducting education programs individually or calling all the students together in one place and just creating awareness on what gender-based violence is, and also educating the children on how to go about such issues. So education programs can be done in the communities, in our communities. That is just to teach about healthy relationships and consent and respect. That is between maybe the children and the people interacting in the community. Also, education programs can be done in schools. This is when, for our case in Helping Hand, we have we call them field officers. The field officers are mandated to do school visits. So when they do the school visits, they do not only educate our sponsored students, rather they sit with maybe the whole school or a group of students from the school or a class in the school and educate them on the same. So collaborating these education programs on gender-based violence in schools, in community organizations, will create positive awareness and also educate the children on this issue. My next point is community engagement. This is done when the community organizes events and workshops and seminars for people in the community, in a certain age or generally in the community, just to provide an insight and educate them on gender-based violence and the impacts it has on the communities, because GBV will not only affect the individuals who are involved. Let's say in a family, if we have someone or a child who has been affected, It will affect the parents, the guardians, also the siblings, and how they'll interact with people out there if the case really spikes to the community knowing about it. So creating community engagement will give awareness to the people in the community, in that if there's such an issue in the community, it will help with the survivors, the victims. It will help the victims, the survivors, on how to go about their day-to-day lives. It also help those people in the community to know how to handle such victims and survivors of gender-based violence. Okay. Another point on how the media can assist in positively creating awareness is partnerships between NGOs and such advocacy groups. When we come together from different groups with different perspective, we try and come up with a specific goal on how we'll want to manage and create advocacy on gender-based violence. So collaboration between NGOs, advocacy groups, and also the government, because in Helping Hand, our field officers work closely with the chiefs, the administrative persons in their local areas, just to also be close to the community, so that when such an issue rises, they can be involved in how they handle the victims, the survivors, and also ensuring that that issue is solved in the correct manner, on how it should. Another point on how media can assist in creating awareness and educating the masses is by organizing cultural and artistic forums. We have different artists and people who do art projects, such as plays, there's art exhibitions, music, that explore gender-based violence themes and promote the understanding on how these things are done. So if we urge our artists, we urge our actors, our directors, our film personnel, that is the directors, to try and explore gender-based violence themes in the work they're doing, to create plays with the themes, to create music with gender-based violence themes. This kind of storytelling.
Recording in progress.
Sorry? This kind of. Sorry, I can hear myself. Is everyone getting me?
You're good, Faraj. You can continue.
Okay. So my point was on artistic expressions. So when we get artists and musicians to try and incorporate gender-based violence themes in their music, in their artwork, in their films, this will assist in creating awareness out there, so that I can say the young generation really likes music, likes art. So this is a very good way of creating awareness and educating the masses on gender-based violence. So those are the few points I had on the same question, unless someone has another question. So I believe by employing these strategies, the media can really contribute significantly in creating awareness on what is really happening in terms of gender-based violence, on what is the way to go about it, on how to handle the victims and survivors of gender-based violence, and how to take up such cases if it really comes up to the media. So thank you. Being told time is up.
Yeah, thank you so much, Faraj, for the amazing
Yeah.
conversations. I've learned a lot from you, like how a journalist can share information about gender-based violence without really the victims really experiencing victim blaming. Also, the way to go through education through knowledge and skills development, like Mama Rachel Ruto, the First Lady of Kenya, said to us during the ASC summit. Thank you. So I'll jump into the next question, but kindly panelists,
Sorry,
make sure you keep time.
let me also add something.
Okay.
Let me add something. I've heard you mention on skill and development issues. Let me just talk about what we do in Helping Hand. So we have a skills and development and livelihood program. So this basically is like an learning institution where it incorporates widows, young girls, and just women who are affected in the community. So such programs, they provide skills. So basically, Helping Hand provides computer skills, mobile phone and electronic repair skills, henna artwork, and baking skills. So these are just some of the ways on how such skills can help the survivors and those victims who are also involved in gender-based violence to keep them away from maybe having to think about what happened or what the case is. So such skills and development centers can really help the victims. Thank you for reminding me that point.
Okay. You're welcome so much. Okay. Yeah. So thank you, Faraj, for your time. And we'll jump in right next to the next panelist, kindly. And I'll request kindly, let's keep time within your time limits. Each question is 6 minutes. So try to answer it within the time margin so that we can have time. Hello.
Yep, you're back now. You're good.
Yeah.
Oh, okay. So, Manuela, can you hear me?
Yes, I can. Can you hear me?
Yeah, I can.
Okay, there is a bit of background noise around me. I hope it's okay. Can you hear me all right?
Yes.
Yeah, you're very clear.
Thank you.
Yeah, my first question will be, you work for Together for Girls and you do a lot of research and analysis and all that. So I'll ask, how do Together for Girls leverage data to guide evidence-based solutions in preventing sexual violence against girls? And what tangible impact has this data-driven approach had in breaking cycles of violence?
Sure. Thank you so much. Thanks for having me. It's a pleasure to be here. At Together for Girls, data is at the heart of everything we do. And we take a public health approach to solving the issue of violence against children, especially sexual violence against girls. And in public health, in order to address an issue, we need to understand it. Hence the importance of generated data. And that's why we are partnerships. Together for Girls, in its essence, we are a global partnership. We believe in the strength in numbers because the issue of violence is immense. And that requires a joint effort to break the cycle of violence. And we are proud of our partnerships because it brings together partners that often do not work together. Government, civil society organizations, the private sectors, and critically, survivors of sexual violence. So in generating data, we mainly support countries through the Together for Girls partnership to implement the national surveys on violence against children, so the VACs, but we have also other ways of generating data. As you mentioned, Bridget, we conduct secondary analysis of the VACs. We support other data collection, other qualitative research, but with a focus on the VACs. To answer your question about leveraging the data to guide evidence-based action. So the VACs are nationally representative surveys. We survey children or individuals aged 13 to 24-year-old males and females. We generate data which are age and sex disaggregated on the magnitude, the scale, the prevalence, the risk factors of violence, all the forms of violence. Importantly, VACs are carried out by local governments. And I think this is really important, that we give the lead to national government to do that, to coordinate an action.
Manuela, oh, we had lost you for a minute.
Can you hear me now?
Yeah, we can.
Perfect, okay. So today, VACs are the largest source of data on violence against children survey in the world. We work in 23 countries, this provide data on 12% of the world's children, adolescents, and youth. This is really big for us to understand the issue of violence against children survey. And most VACs have been conducted or have received funding from PEPFAR, because of the link between HIV and violence. I wanted to talk also about the multiplicity of actors involved, from when we generate the data to when we actually use these data to turn them into national action plans. And this is really important so that the data doesn't stay there isolated. The data is used to develop evidence-based solutions. And we've seen that in many countries, wherever we've conducted a study, a global study. We interviewed 225 stakeholders around the world in VACs countries, and we observed that in every single country where the VACs was implemented, change occurred. For instance, in 13 countries, there is an improvement of child safety and laws. In 10 countries, there is a ban of corporal punishments. In 9 countries, there is a ban of child marriage. So that's quite powerful. Now, I want to just bring a focus really briefly on Kenya, because Kenya has done a remarkable journey toward protecting the children. As I mentioned before, Kenya conducted 2 VACs, one in 2010 and one in 2019. And it was the first country in the world to conduct 2 comparable VACs over a decade. And a comparative analysis, a quantitative analysis of the 2 VACs reveals that there were notable declines in the prevalence of lifetime sexual violence between 2010 and 2019. This is really showing the power of the data, right? And we really saw, for instance, that in the case of sexual violence, the prevalence of any childhood sexual violence was reduced by half for females in Kenya. 2010, it was 32%, and 2019, it was 16%. Surely something good happened in Kenya between these 2 periods. And the data was really helping us to really understand, to highlight those. So we conducted, in partnership with LVCT Health, a Kenya-based research organization, a qualitative study of stakeholders involved in, all that constitute, as I said, the multi-sectoral approach to address the issue of violence in the education sectors, donors, etc., to understand, according to them, what perspective led to violence. So I invite you to read this qualitative research, and we do hope that these findings from the qualitative research in Kenya can inspire other countries in the region, so we can learn from the government leadership, from the strengthening systems in Kenya, from the community awareness, from the media work, as Faraj mentioned. All this work that contributed to reducing violence in Kenya can inspire other countries in the region as well.
Yeah, thank you, Manuela, for the amazing insights that you've given to us and for praising our country, Kenya. Evidence-based data is the only way to go, because if you don't have facts, then there's no way you're going to operate. And so for those who are listening, remember to always use factual information, social media engagement, always follow up on all the NGOs that are present, so that you can see the amazing work they're doing on social media, not only for sensitizing people around gender-based violence, but also other factors and issues that they are facing. Girls Health Ed, we deal with comprehensive sex education, so follow up on us and you can find out more information. So Manuela, for the last question, what innovative programs has Together for Girls implemented to address the unique challenges of sexual violence against girls, and a comprehensive approach that you use to prevent and healing and justice for these girls? Thanks.
Thank you, Bridget. For this question, I want to give the specific example of a recently launched initiative called the Safe Futures Hub, which is a live hub that provides solutions to end childhood sexual violence. So that was launched around September. And through this hub, we are creating an open space to access, to generate, to implement solutions to preventing childhood sexual violence. So this is really powerful. As a researcher from the Global South myself, I sometimes struggle to access data. I struggle to publish my work. And this is a reality of many researchers who are doing tremendous work, even practitioners. Sometimes those practitioners have this practice-based knowledge and experience to share, but because they live in fragile settings, such as humanitarian settings or rural areas, or survivors themselves who, as I mentioned before, are critical and should be placed at the center of the work that we do. But because I take the example of girls with disability, it's really hard to hear the voice. So the Safe Futures Hub comes to unite all of us working around the world to create a safer future for children. So it brings together advocates, strategists, policymakers, frontline workers, and youth voices as well. So what we try to do in this Safe Futures Hub is to redefine knowledge. What do we mean by what works to prevent sexual violence against girls, against children more broadly? So promote diversity, as I said, to really break this underrepresentativity of researchers of knowledge around the world. So inclusive, to ensure that to promote diversity and collaboration. Secondly, we want to build knowledge as well, to generate evidence for change on what works to prevent childhood sexual violence. And then we want to mobilize this knowledge. So this is work in progress. As I mentioned, it was launched earlier this year. I just can't wait for all of us to contribute to this platform where all of us will be able to go and access this data live. And that researchers, even from the furthest part of the world, can go there, discuss their work, publish their work, and challenge the work that is there. And this will help us as well to rethink the issue of childhood sexual violence, how we understand it, how we defining, and how we create solutions to break the cycles of violence. Thank you.
Wow, amazing insight, and thank you so much for attending. For those who are listening, I would like to say that technology, when the 21st century
Bridget, are you still there?
We seem to have lost her.
We seem to have lost Bridget, right? Okay. Okay, so yeah, perhaps I can ask oh, I think we got Bridget back. Hi, Bridget, are you there?
Yeah.
Okay.
Sorry, my network misbehaving. I'm so sorry for that.
That's
so
okay.
as I was saying, Elizabeth Achieng, hope you can hear me. Kindly introduce yourself. You have 2 minutes. Elizabeth is one of us. She's a teaching fellow at Girls Health Ed, but she's also working for another organization as a facilitator under the Department of Gender. Elizabeth, the floor is yours.
Okay, hello everyone. Sorry for the inconvenience. I had issues with my connection. My name is Elizabeth Achieng. I'm a facilitator with Girls Health Education Program. I'm also an intern facilitator at Shofco, Kenya Gender Department. Being born and raised in informal settlement, mostly known as slums, many young girls, women, and teenage mothers get assaulted, violated, rejected of their rights, and this made me so passionate in helping women and girls and urged to change the community mindset. Many women get violated and they don't speak out. My role both at Shofco Kenya and Girls Health Education Program has impactful to girls, teenager mothers, and women. The journey has not been easy, but we keep pressing to change through educating them, and the culprit are forwarded for legal action.
Okay, thank you, Elizabeth, for the introduction. Now we'll just jump right into the questions. And the first question will be, how can we ensure that technology solutions for personal safety and promoting healthy relationships are accessible and inclusive for all individuals?
Okay, I'm going to discuss these in 4 phrases: parenting, romantic relationship, caregiving, and clinician-patient relationship. Okay, point number 1. Parents should control all the content and people their kids encounter online. Parents should also set firm screen limits. As we know, social media is also important for teens' social development and well-being. Also assist with the homeworks and research. Second, in romantic relationship, technology can enhance couple relationship through texting and video calling. Some couples manage conflict as well as express affection, location sharing to coordinate plans. In caregiving, technology has helped in caring of elderly parents at a distance. Has also helped to address some needs to remote caregiving and elderly parents, such as medication, working out loneliness. Clinicians, use of mental health apps help parents benefit through therapists. Also have the opportunity to give parents as they use app for emotional well-being. Thus, we support to connect to the children and support their autonomy. Parents can engage with the games and social media their kids are using. Adapting connected devices for emotional communication on games to cope with the social anxiety. Yeah.
Oh, thank you for the wonderful insights. And for the other question, in combating gender-based violence on a global scale, what strategies can different organizations employ to collaborate and share best practices and resources?
Okay, education at every level is one of the key solutions of GBV, and since it is a learned behavior, it can be unlearned. Educates women on their rights and how to report violence and to reject harmful gender norms. Okay, we can understand the specific roots causes of GBV in each community. We can believe and support survivors, challenge other gender norms, men and partners and allies. We keep girls in school. We can empower women economy and financially, like opening work for them. Focus on community chants. Legislate women be afforded with legal protection. Treat GBV as a public health issue. We can normalize mental health and psychosocial support system. Commit to additional safeguards against GBV during crisis and conflicts. Yeah.
Okay, Thank you so much, Elizabeth. And Elizabeth has been very helpful and impactful as part of the Girls Health Ed organization teaching fellow, because she has been supporting me in getting survivors who can share their stories via social media handles and on our social media houses. And this has been very helpful. We have had several shows, and we are continuing the same show with the discussion of not only gender-based violence, but also the issues to do with comprehensive sex education. She has also touched on something that the government of Kenya has been doing in partnership with PEPFAR. That's the support of gender-based violence and making it a public health issue. And it's the #1 health issue in Kenya currently. So thank you so much, Elizabeth, for the time and for touching that. And I'll jump into the other panelist, Reverend Cyprian Yobera. Welcome, Reverend. You can have 2 minutes to introduce yourself.
Okay, yeah, my name is Reverend Cyprian Yobera. I have been, I'm all kinds of things. I would say that personally, my purpose is to add value to people, and more specifically, those that are downtrodden, those that are abused, those that are marginalized. And that's how I come into this conversation. I am a priest by profession, but I also do various other things that are all connected to the issue of adding value to people's lives.
Wow, so humble, yet so diverse and experienced. And that's why we have you here. So I'll just jump into the question. In the fight against gender-based violence, how can we use men and boys as allies, both individually and within the communities? And could you also kindly cite examples of men engagement in this fight?
Okay, yeah. First of all, so for me, I'm hearing all the conversations that are going on there, and they're all very clever, and they're all there's a lot of data and all very, very well arranged. Mine will not come from that kind of direction. I'm more thinking a little bit into maybe you can say philosophically some of the roots of the problem here. So I think that we should not talk about boys as how can we almost like add boys into the campaign. I really think that the gender-based violence issue leans, when we say gender-based violence, we are talking about violence against women and girls. Let's just call a spade, you know. There's no gender-based violence that is against boys and men. We are saying it's gender-based. It's that somebody is being bullied and being beaten or being violated because of their gender. There is very little going the other way where men are bullied because of their gender. So I just wanted to make that clear. But so that being clear, therefore, any solution that is going to come and be sustainable is a solution that is driven by men and boys. You understand? Because the girl and the woman has not done anything wrong, so that she ought to be working hard to change herself. It is the man that is on the wrong. In gender-based violence, it is the men and the boys that are doing something wrong. They are the ones, we are the ones that need to change. And so the campaign, a successful campaign, needs to be led. You've lost your light.
Yeah.
A successful campaign needs to be led by men and boys, and very strongly so, and then using all the work that that girls and the women have been doing. Am I still on?
Yes, I can hear you.
Okay. Yeah, we were still seeing you, by the way, even with the little light that you had on. Yeah, and so for me it's fundamental. So then now we look at how or what areas should we be focusing on, and I believe that it starts right at the cultural level, because some of this gender-based violence is informed by warped cultural practices or warped cultural values, where a lot of our cultures were very male-centric, very male chauvinistic. And to change a culture, it takes a lot, but we have to accept that it is coming from culture first and foremost, where women were tools, women were counted amongst the children, women were toys, girls can be toyed around with, that's very deep in the psyche of the man generally, so that when we are discussing these issues and when we are saying, let's take it to parliament, let's take it to the bigger stages to be discussed, you can see it sometimes in the sneers that you see in the men while they're discussing issues, and it's almost like we are just playing with the conversations. We are playing around with the conversations, because deep set inside, a man might still be believing, even in this generation which is so developed, a man might be believing in his mind that a woman is a tool, a woman is to be counted amongst children, should be at the very best subservient to him. Yet this is also talking about equality. So to change a culture, we have to first start by acknowledging that there is that warped way of thinking for men. And as I've said, it needs to be male-driven. And I would think in terms of getting people that would be champions in the different arenas, in the different levels, in the different stages, in the different aspects of our society around us, that we would look for champions that would then push for culture to be changed. The gentleman who talked earlier, I just found him talking, I didn't hear his name, talking about media and involving media. Yes, media is very, very helpful in changing culture. And we need to be very, very deliberate about saying, we want to change the culture right from the value of the girl, the value of the woman in our society, the value of our mothers. We have to start there, and we have to emphasize it and retrain ourselves. We've talked about redefining knowledge. Yeah, the knowledge that we have is warped, and it needs to be redefined right from that basic tenet that says each person is valuable. Each person is valuable, equally valuable with each other. And for the religious, because I'm sure you're going to ask a question on the religious end, and those that will believe in God or a higher power will say that each of us as human beings have been created with value, and therefore there is something innately valuable in each of us. That needs to be understood at a very, very fundamental level for us to combat this gender-based violence.
Thank you so much, Reverend. You've taught us a lot. That number one, women should love and value themselves just the way they are. And then that in this kind of engagement, we should put men at the forefront for the fight against gender-based violence, because it mostly comes from them to women and not the other way around. And we should also work around culture, changing our cultural norms, how we live, how we behave, and how women are treated, and that women should be treated as of much importance the same way men are treated. So thank you so much. To the next question. You are jack of all trades, like you have a lot, you're Reverend, you're a leadership coach, you do things to do with homeless support and resettlement. You also have your own organization and you're the director. So I'll ask, well, how do you handle all this while actively contributing to the social change initiatives, both personally and professionally?
Yeah, so for me, it's the easy answer is the fact that all these things that you're talking about that sound like I'm a jack of all trades are all focused on one thing, and that is adding value to people, adding value to people's lives. So even while I'm in church, it's a different arena. It's a different kind of people because there are people of faith. There's a different value system. There is a value system that they are all agreed on when you're doing it in church, making it quite easy to bring the education across. But the thing I'm doing even there is working at adding value to the individuals in front of me. So in Kenya, I set up the organization very, how can I say, just really proactively. It's about meeting the needs of those in the slums, and it's about adding value. So our organization reaches out to kids, the perhaps the poorest of the poor. Within informal schools, we feed 600 children in school every time they come to school. And as we are doing that, we are saying we are working at enhancing the educational experience of the child who comes to those schools, thus adding value to them. But they feel valued. I have been to one of those schools when on a Monday, and I was told that there was a child that arrived that was fainting, and when the teachers worked hard to revive the child, they found that the child had not eaten anything over the weekend and was waiting for lunchtime, since we feed only in the schools. A child like that will, their value is really lowered because of the way the society has sort of marginalized them. And so we are there adding value through them. But more, I think, pointed to our topic. In one of the schools that we work, there's a time that a girl went absent for a while. This is a girl that had reached at the time standard 7, and she went absent for a while, and we started wondering where she was. And later on, she was found, and this is quite a serious story, by the way. But later on, she was found, and then she was telling her story of what had happened to her. And what had happened to her is that her adoptive parents, which was an uncle and an auntie, had decided that this girl had grown to the point where her body was a woman enough. And so they had then, and this is all in the slums, and so they had created a nice room for her where then men would come and pay to use her sexually, and pay their uncle and auntie, and so on. I tell this story not just, yes, it is violence, it is sexual exploitation, it is child abuse. There are so many things in one event. We had to work hard, and actually, if there is anything that justifies kidnapping, we had to actually kidnap her before we then reported the whole story to the authorities. But there you have it. Now, this girl had gotten to the point where her value was so low in her own head that when we were interviewing her about the situation, what was hurting her most is that her uncle and auntie would not even share the money that they were earning with her. Not the fact that she was being molested and abused in this way. That's how low she had lowered herself. So the society can surround us, and the people around us that are supposed to be protecting us can get us to feel so bad about ourselves that we start thinking that way of ourselves. And so my organization comes into that situation to add value, and that's why we focus on the issue of adding value, to re-educate the girl so that she values herself, but to educate the men so that they protect. One other example on the protection side, there are then some boys that got so psyched about this, about protecting their sisters. They now call them their sisters. And in the slums, sisters are vulnerable, and they said, we are going to work hard at our skills, raise money, and make sure that the girls that are nearby in our society go to school, because when they are in school, then they are exposed less to this gender-based violence. And so they got together an acrobatics team, and they really worked hard. They do very great acrobatics, and they are paid lots of money, and all the money goes into sponsoring girls into education, and that's just fantastic. So those are the sort of people that we support.
That's a great work you're doing with your foundation. I believe you're the founder and also the director of that organization. And yes, child sex trafficking is a thing in Kenya. Despite that, we're saying there are changes that we've felt in the country, and a lot of NGOs and CBOs have been developed. A lot of work is being done, but it's still a challenge that needs to be addressed, and we will continue as the organizations present here, and also other people we call on other key actors to support this process. And I'm grateful to the government for the initiative they have taken on the issue of gender-based violence, because it's in the #1 in the country in the coming years till 2027. So yeah, thank you so much for the insight, and I look forward to continuing this conversation once you're done with the call. So my last question to you will be the role of religion in ending GBV, because I understand that NGOs and CBOs, we do a lot of work, government does a lot of work, but coming from the point of religion, people tend to listen more than from the other point. So what is the role of religion in this?
Yeah, like I think I already alluded to it, but you're right in saying that people do listen, and they do listen more carefully. So the role of religion in this, again, I think it's centered on what I call my purpose in life, and that is adding value. Just bringing the sense of the fact that a human being is not a toy, can never be an animal, it's not like other animals, as much as our science tells us we are an animal. There's something very, very, very intrinsically important about a human being that is not in animals. A human being, a girl, cannot be a tool, cannot be an object. There's a lot of objectifying of people, especially girls and women, in social media and all over. And religion brings that squarely back to where it should be, bringing the value of the woman as created by God, as special, and as created in the image of God, and therefore to be protected squarely. I think that message comes strongly, most strongly from religious circles.
Yeah, thank you so much, Reverend, on that insight of how religion can be involved in this. And lastly, but not the least, I'll jump into Pavita Singh, who is the Executive Director of Girls Led. And I would like to ask her, to what extent do mental health issues and trauma contribute to GBV, and how can we effectively address these underlying factors to prevent and support survivors?
Yeah, thank you so much for the question, Bridget, and thank you to all of the panelists for your incredible insights thus far. Reverend, I would especially like to thank you for setting up the conversation that I would like to start about looking at the role of culture first. So GBV is a very complex issue that has many underlying factors, including mental health. There's a saying that goes, hurt people hurt people. So when we're thinking about the issue of GBV, there oftentimes tends to be a victim to blame the perpetrator of gender-based violence. And it's a very, it makes sense from a human nature standpoint to want to blame the perpetrator for the act that they're doing. But we need to take a step back and understand, why is it that the perpetrator is doing the, perpetuating this act of gender-based violence that they're doing? So it must be that either there's something hurting in themselves that needs to be addressed, which I'll talk about in a bit when we get into mental health. But before that, I want to take a step back, just as, Reverend, you very nicely opened this conversation about looking at what is it in the culture that is, propelling these boys, young men, or anybody else who's a perpetrator of gender-based violence to do the acts that they're doing. And we need to look at not only the individual factors, which is the mental health, which I'll be talking about shortly, but what are the social and cultural factors that are allowing this to take place? And that is the key premise behind what Girls Health Ed does, is that we're trying to, by teaching girls and young women the tools to love themselves and take care of themselves and live happy and healthy lives, we essentially want to not only improve their physical health outcomes and their, social and emotional health outcomes, but also improve their self-confidence and give them the tools to change the social and cultural norms that are in fact perpetuating gender inequality. So I would like to actually take a step back and give an example from my own culture. So I am of Indian ancestry, and I know that there's a huge Indian population in Kenya. So I am sure that my Kenyan colleagues will be able to relate to this as well. But this is something that has really been on my mind a lot lately. So when you go to an Indian household and, you're a guest in somebody's house, there's a tendency for the host to, offer them to have some tea, to have something to eat. And it's very difficult as the guest to say no, because then your host will be offended. And think about what role this think about what position this puts the guest in. So if I'm at somebody's house and, for example, let's say I'm not feeling hungry or I've eaten quite a bit, but my host is still insisting and insisting and insisting that I keep having more, that's also a sense of not having control over my body. And so if as a guest in somebody's house, if it's perpetuated in the culture that I can't say no to something as simple as having tea or having a snack at somebody's house, then how can I be expected to say no to anything else, whether that be engaging in, unhealthy relationship dynamics or engaging in unhealthy sexual dynamics? And so something as simple as having tea, maybe perhaps, if, the next time somebody comes to your house and they say, no, thank you, perhaps don't take it personally and understand that perhaps they're just not feeling it, and it's not about you. But it all starts with changing those very simple social and cultural norms that are not allowing somebody to feel comfortable saying no to what will make their own body and their own soul and their own psyche feel comfortable. So that was just something that I wanted to share from the social and cultural standpoint. But now let's revisit the mental health. So as I mentioned earlier, hurt people hurt people. And so if somebody is, perpetuating gender-based violence, it's because there must be something in their psyche that is contributing to this behavior. So if we look at individuals with certain mental health disorders, and this is not by any means to stigmatize people with mental health disorders, because there are also, there's 3 out of 4 adults in the world who do struggle with mental health disorders, but then do not go on to engage in unhealthy or harmful behaviors. That being said, if mental health is unaddressed, people with certain mental health disorders might struggle with impulse control or anger management or empathy, and that can contribute to behaviors that fall within gender-based violence. Other disorders such as conduct disorder or antisocial personality disorder or certain substance use disorders might also be linked to aggression that can manifest in gender-based violence. But then the other thing is that the perpetrators need help too. So oftentimes when perpetrators have experienced trauma themselves, they're more likely to perpetuate violence. So things like childhood abuse or exposure to violence can contribute to the cycle of violence because, people who observe these behaviors might think that that's normal. And so it really starts with educating youth from an early age and intervening early when people have experienced any type of trauma or mental health condition, so that we can change those social and cultural and interpersonal factors and intrapersonal factors that are contributing to gender-based violence. But Now, I'd like to take a look at the impact on the victims and the survivors. So survivors of previous trauma, whether that be domestic violence or sexual assault or other types of gender-based violence, they might experience a heightened vulnerability that might put them at risk for further victimization. And so gender-based violence can actually exacerbate existing mental health issues or lead to the development of new ones that absolutely must be addressed. And individuals with mental health challenges might also employ maladaptive coping mechanisms, whether that be substance use or self-harm. And unfortunately, we've seen that in girls' health ed workshops, where we've had girls and young women in our workshops who have been bullied at school because of, such things as how they look or how they act. And we had one girl in our workshop who was harming herself because of the bullying. And she shared that because of her experience in girls' health ed, she was able to value herself even more and therefore stop harming herself. So now coming back to the culture, unfortunately, many of us are living in societies that stigmatize mental health, and therefore they don't make it easy to address any mental health issues or trauma that we might be facing. And so we as a society need to change the conversation surrounding mental health so that those who might be struggling are able to address their issues and therefore not escalate and contribute to the cycle of gender-based violence. And then we need to make sure that we're allocating sufficient resources into, the treatment of mental health conditions, but also into the prevention of gender-based violence. And then finally, I'd just like to say a note about intersectionality. So there's the intersectionality of gender with other factors, whether that be race, ethnicity, socioeconomic status, sexual orientation, reproductive identity, which is a new and emerging category of identity. And these can also amplify the impact of mental health and trauma on gender-based violence. And so that's why Girls Health Ed takes a very intersectional approach to the work we're doing, catering our workshops to the specific needs of the girls and young women whom we're serving. And in fact, our curriculum is actually co-created with the girls and young women whom we're serving based on their specific social and cultural factors that are affecting them. And so with that, I would like to thank Bridget for convening this amazing webinar and posing all of these questions to the panelists. But now I'd actually love to give a chance to our audience members and our attendees to pose questions to Bridget or to any of the panelists.
Okay, thank you so much, Pavita, for that amazing conversation. We've talked about body image, which is a challenge that women have been facing. So they go to different lengths to change the way they look because they are being bullied, especially those who are approaching puberty or those who are experiencing puberty as of the moment. And we have had so many stories, but those girls who have taken our program, there has been a change in the way they view themselves, and they have come out strong and proud of the way they look and the way they behave in the general living standards. I've also like to say thank you also to pointing out that mental health is an issue that cuts across not only during gender-based violence, but also in other aspects of health and also economically, that people are suffering from mental health issues and they don't know about it. And so we should integrate mental health in our programs, and as Girls Health Ed, that's what you're doing. We always have an aspect of mental health, and other organizations, other people out there who are listening to us, always make sure that there's an aspect of mental health, because it's a great challenge and an issue in all this. So for those who are listening to us, if you have a question, you can kindly text or raise your hand at the chat, and I'll be sure to ask the question out loudly to the panelists who are with us. And as we're looking for questions, Pavita, kindly, you can kindly tell us how can health and mental health professionals be integrated or be involved in supporting GBV survivors, and what are some of the steps that are essential to seamlessly incorporating education on GBV prevention and gender equality, both in formal and informal education systems?
Yeah, absolutely. So I think that that's exactly what Girls Health Ed does, is we provide comprehensive sexuality education, both in formal and informal education settings. So the way that our delivery model works is that we have trained teaching fellows who are young women recruited directly from the communities in which we serve. And then we train them in our curriculum to then go into schools and community centers to deliver our workshops. So not only are our workshops taking place in schools, in formal education settings, so whether that be during the school day or during a lunch hour or during a break period, we also have workshops that are taking place after school, but also in community centers. But the idea is we want to meet the girls and young women where they already are, so that we're not making them come to us, but we're meeting them in the spaces where they already are and bringing our programs and our offerings to them. On the note of, in terms of how mental health professionals can be integrated to support the gender-based violence survivors, again, I think it's crucial to address the complex mix of emotional and psychological and interpersonal impacts of such experiences. So one way is through trauma-informed care. So mental health professionals can provide trauma-informed care that recognizes the widespread impact of trauma on survivors. And this includes creating a safe and supportive environment, understanding the effects of trauma, and avoiding re-traumatization. And this is, again, something else that we do in Girls Health Ed workshops, which is where, and this is the reason that we, boys and young men, as much as we need programs and offerings for them as well, and this is something that I've long been pushing for, we needed to create a safe space for girls and young women themselves. And that's why our workshops are only open to girls and young women, so that they feel that they have a safe space to actively and openly discuss the issues that they're going through. And then we train our teaching fellows. So here in the US, for example, our teaching fellows are required to go through mandated reporter training, so that if they're seeing any signs or warning signs of abuse or harm to the self or to others, they know how to identify it and know how to report it. Other than that, I think, including psychoeducation, so including mental health as part of the education that you're providing in any sort of comprehensive sexuality education, and that's certainly part of Girls Health Ed's work as well. Making sure that there's support for issues. So, for example, if we do identify girls and young women who might be going through something and might need additional support that is beyond the scope of what we're able to offer, making sure that we have a list of resources that we're able to provide them, again, which Girls Health Ed has done. And we've been able to help many survivors of gender-based violence find the adequate support that they need. Advocacy and empowerment, so training these girls and young women to be advocates for themselves and their communities, for the change that they wish to see in their communities. And Girls Health Ed has been very effective at doing that. So we have anecdotal evidence that has shown that after participation in our workshops, these girls and young women actually feel more comfortable talking to their classmates and their family members and their community members about what they're learning, and then taking active steps to change certain aspects of their social and cultural environment that are not necessarily healthy for them and that are not aligned with them living their best and most productive lives. And then, as my colleague Manuela has said, making sure that we're continuing to invest in research and research and data and advocacy, because any intervention that we do must be evidence-based and rooted in medical accuracy and scientific knowledge and data that is coming from evidence-based research. So.
Yeah, thank you so much for that explanation and for telling us what Girls Health Ed do. And yes, we have two ways of engagement. We do schools engagement and also community engagement, so that we can reach out to girls who are shy and don't want to come or for those girls who don't go to schools. So we reach out to them and we get to talk to them, engage with them, and know what are the issues they're facing, and they come out stronger on the other hand. Also, we are educating organizations. We provide correct and accurate information to these girls. And if they require further services, we also link them to organizations that do service delivery or provide extensive psychosocial support. So thank you so much. Now I'll give a minute for our listeners and the attendees who are there. If they have any questions, they can text, or they can raise their hand, and I'll ask them, after which we'll close the webinar. Thanks.
Or perhaps if any of the panelists have questions for each other.
Okay, since there are no questions, I'll give each 1 minute to give us a parting shot, after which we'll wind up the webinar. Thank you. So I'll start with Faraj, if you can hear us. Faraj, are you with us?
Yes, I'm losing you a bit, but I've gotten you.
Okay. You
I
can
hope
just give
I'm
us a
clear. I hope I'm clear enough right now.
Yes.
Okay. I'd just like to first appreciate for this opportunity to be here with you guys to learn about what girls' health aid is. I would also like to appreciate the fact that I've brought in something in terms of media and my field of operations to give you an insight on how this can be handled. I like the initiative. I hope we'll get to really work together in tackling this issue. So thank you very much.
Okay. You're welcome, and look forward to meeting you in person. Then the next person is Elizabeth. Tell us something as we go.
I would like to urge everyone to come together and to eradicate this verse of GBV and use technology for personal safety and promote healthy relationships. That was my time, and thank you so much.
Yeah, thank you too for attending. We should always use technology in a good way, and not always for cyberbullying or gossiping and all that. Yeah, we can do tech for good. That's it. Thank you, Elizabeth. Reverend, it's your turn.
Okay. I want to urge our men, and seeing that it was only Faraj that was a man and myself on this forum at the moment, to come up with a campaign that is led by men. And that campaign, with due respect to everything that is going on right now, which is very positive, which is girl-driven, women-driven, that the campaign that by men concentrate on the positive aspect rather than the negative. So rather than tell our fellow men, don't beat your women, we go to them and say, protect your women, value your women, cherish them, clean them, praise them, support them, all those things to do with protection and respect and valuing and validating, giving them time, so that then from the campaign get champions that will go around and model this valuing of women, model this cherishing of women at all levels, community, government, so that it spreads right around the society. The gatekeepers of our villages and so on need to be sensitized into valuing, protecting, respecting, validating, that the education aspect in this be one that is touching us right at the cultural level, so that our minds start changing, our stereotypes start changing, and so on. So, but my big emphasis is focus on the positive. Let's protect our girls. Let's cherish them. Let's value them. Let's validate them, and move on, so that this changes, and people like Faraj can put that in the media, create songs, create games, games that we play on social media that focus on lifting the girl up, giving her a platform where she's respected, protected, valued, validated, and so on. And may you all be blessed. Thanks for giving me the opportunity to speak.
Yeah, thank you so much for joining us and giving us your time. And yes, to men who are listening, kindly be engaged, be proactive in protecting the women around you, not only your sisters and your brothers or even your spouses, but also other girls in the community. Thank you so much, Reverend. Now we'll go to Manuela. You have half a minute.
Okay, thank you so much. Yeah, I want to close also with a message of hope, saying that change is possible, that childhood sexual violence, against girls, against boys, is preventable, and the VAX processes that I've explained in my reflections earlier demonstrate that change is possible. The significant reduction in violence against children and youth in Kenya since 2010 highlight the importance of data in providing evidence to inform policies, practice that aim to prevent sexual violence against girls. So it also demonstrates the impact of governments, organizations, partnerships, and individuals working together to create safer communities for our girls. Africa is positioning itself as a champion in generating evidence. I talked about the fact this has been mainly conducted in African countries. So we want to see more countries in the region to do that. Congratulations to Girls Health Ed to bring us together. This was a fascinating panel. We all come, from different, working background, and it's really fantastic to bring us together. These events are important as part of the 16 Days Activism, and as well, as we go along in preventing violence against children. It's important to celebrate this win. It's important to learn from each other. It's important to have these reflections so that we can continue effort in strengthening the links between research, policy, and practice, and also advocacy, putting the voice of survivor at the center of everything we do. Thank you.
Okay, Pavita, you have 5 seconds.
Don't blame the perpetrator, but rather understand what are the social and cultural underlying factors that are contributing to a perpetrator's behavior of gender-based violence, and understand that we do have the power to change those social and cultural norms. And in closing, I just want to thank Bridget for an incredible job that you did, spearheading this campaign and this webinar all by yourself, on behalf of all of the panelists and the attendees and all of us at Girls Health Ed. We're very proud of you.
Thank you so much to all of you for accepting my invitation and for listening to this webinar. It would not have been a success without you. So thank you so much. We can always link up after this. We can continue these conversations and see how we can work together. Otherwise, I'd like to wish you all a lovely day, a lovely evening, and goodbye to you all.
Bye-bye.
Bye.
Bye.